In the realm of mental health, few disorders are as misunderstood as obsessive-compulsive personality disorder, commonly known as OCPD. Often confused with its more widely known counterpart, obsessive-compulsive disorder, or OCD, OCPD carries its own unique set of challenges and complexities. While both disorders share a penchant for order and control, OCPD runs deeper, permeating an individual's entire personality structure. Unlike OCD, which manifests in intrusive thoughts and repetitive behaviors, OCPD is characterized by an enduring pattern of preoccupation with orderliness, perfectionism, and control. This preoccupation transcends mere quirks or preferences. It forms the very foundation upon which individuals with OCPD build their lives. Their unwavering need for structure and predictability extends to all aspects of their existence, from their work and relationships to their thoughts and emotions. While the pursuit of excellence and a well-ordered life are often seen as admirable qualities, in the context of OCPD, these traits become exaggerated and ultimately debilitating. The relentless drive for perfection can lead to an inability to delegate tasks, an excessive focus on minute details, and a constant need for control that leaves little room for spontaneity or flexibility. To truly understand OCPD, we must move beyond the surface-level assumptions and delve into the core of this complex disorder. By exploring its defining characteristics, its impact on various aspects of life, and the available treatment options, we can shed light on a condition that often remains shrouded in misconception and stigma. One of the most pervasive misconceptions surrounding OCPD is that it is synonymous with perfectionism. While individuals with OCPD do exhibit a strong desire for order and precision, their experience goes far beyond a simple preference for neatness or a high work ethic. Perfectionism in OCPD is an all-consuming need for flawlessness. This relentless pursuit often comes at a significant cost. Understanding this nuanced nature is crucial for empathy and support. Individuals with OCPD often experience a profound need for order and structure in their lives, a characteristic that permeates their thoughts, feelings, and behaviors. This need extends beyond a simple preference for tidiness. It is a deep-seated compulsion to maintain a sense of predictability and control in an often chaotic world. For someone with OCPD, a misplaced item or a deviation from routine can trigger significant distress and anxiety. This unwavering need for order manifests in various ways. In their personal lives, individuals with OCPD may meticulously organize their belongings, adhere to strict schedules, and follow rigid routines for even the most mundane tasks. They may find it difficult to relax or enjoy spontaneity, as any deviation from their carefully constructed plans can feel unsettling and overwhelming. This need for order extends to their relationships and interactions with others. Individuals with OCPD may impose their need for structure on those around them, expecting friends, family members, and colleagues to conform to their standards and expectations. This can lead to conflicts, as others may feel controlled, criticized, or suffocated by their rigid approach to life. The unwavering need for order that characterizes OCPD can significantly impact an individual's quality of life, leading to interpersonal challenges, difficulty adapting to change, and a pervasive sense of anxiety and dissatisfaction. Understanding the nature and impact of this core characteristic is essential for fostering empathy and support for those who live with this often misunderstood disorder. For individuals with OCPD, perfection is not an aspiration. It is an expectation. This relentless pursuit of flawlessness shapes their perceptions and behaviors. Every task becomes an exhausting cycle of striving and self-criticism. The pursuit of perfection is a double-edged sword. It drives achievement, but also a crippling fear of failure. No matter how much they accomplish, it never feels like enough. There is always something more to improve. This self-criticism can extend to others. They may struggle to delegate tasks. They may become overly critical and micromanage. This can lead to conflicts in relationships. Understanding perfectionism in OCPD is crucial. Recognizing the fear of failure and need for control helps develop compassionate strategies for support. The need for control is a defining characteristic of OCPD, often manifesting as a deep-seated anxiety about uncertainty and a relentless drive to manage every aspect of one's life. This need stems from a belief that order prevents chaos and ensures a sense of security. However, this pursuit of control often becomes self-defeating. Recognizing the illusion of control in OCPD is crucial for fostering empathy and support. Obsessive-Compulsive Personality Disorder, OCPD, and Obsessive-Compulsive Disorder, OCD, are distinct conditions. People with OCD recognize their obsessions as irrational, causing distress. In contrast, those with OCPD see their need for order as strengths. This difference affects their experience of anxiety and treatment engagement. Understanding the difference between obsessions and compulsions is crucial for distinguishing between OCD and OCPD. Obsessions, in the context of OCD, are intrusive, unwanted thoughts, images, or urges that repeatedly enter a person's mind. These obsessions often center around themes of contamination, harm, symmetry, or taboo thoughts. For example, someone with OCD might have recurring thoughts about germs, leading to excessive hand-washing. Compulsions, on the other hand, are repetitive behaviors or mental acts that a person feels driven to perform in response to their obsessions. These behaviors are aimed at reducing the anxiety caused by the obsessions or preventing a feared outcome. However, the relief is usually temporary, and the compulsions themselves can become time-consuming and disruptive to daily life. While individuals with OCPD may engage in some repetitive behaviors related to their need for order, these behaviors stem from a different place than the compulsions seen in OCD. For someone with OCPD, organizing and reorganizing their belongings might provide a sense of control and satisfaction. They are not necessarily driven by intrusive thoughts or a fear of contamination, but rather by an internal need for order and predictability. Distinguishing between the obsessions and compulsions of OCD and the rule-bound behaviors of OCPD is essential for accurate diagnosis and effective treatment. While both disorders involve a preoccupation with order and control, the underlying mechanisms and experiences of anxiety differ significantly, requiring tailored therapeutic approaches. A fundamental difference between obsessive-compulsive personality disorder, or OCPD, and obsessive-compulsive disorder, known as OCD, lies in the primary motivation behind their respective behaviors. Individuals with OCD are often driven by a need to escape or alleviate the intense anxiety triggered by their obsessions. Their compulsions, while irrational, provide a temporary sense of relief from the overwhelming fear and distress associated with their intrusive thoughts. In contrast, individuals with OCPD are not primarily motivated by anxiety reduction. They are driven by a deep-seated need for order, perfection, and control, which they believe are essential for a meaningful and successful life. Their rigid adherence to rules, routines, and high standards is not a means to an end. It is an end in itself. They find comfort and satisfaction in maintaining a sense of control over their environment and themselves. This distinction is crucial for understanding the different ways in which these disorders manifest and the most effective treatment approaches. For someone with OCD, therapy often focuses on exposure and response prevention, gradually confronting their fears and learning to manage anxiety without resorting to compulsions. For individuals with OCPD, therapy may involve cognitive restructuring techniques to challenge their rigid beliefs about order and control, as well as developing more flexible coping mechanisms for dealing with uncertainty and imperfection. The goal is not necessarily to eliminate their desire for order, but rather to help them find a more balanced and fulfilling way of life. In the professional realm, obsessive-compulsive personality disorder, or OCPD, can be both a boon and a bane. Individuals with OCPD often excel due to their high standards and meticulous attention to detail. However, this pursuit of perfection can lead to inefficiencies and stress. Excessive focus on minutiae can delay projects and reduce productivity. The need for control can create a challenging work environment. Micromanagement and difficulty delegating can lead to overwork and burnout. Ultimately, the rigidity of OCPD can stifle creativity and innovation. One of the most significant challenges for individuals with OCPD in the workplace is their difficulty with delegation. Their belief that no one else can meet their exacting standards often leads them to take on tasks themselves rather than entrust them to others. This can result in an overwhelming workload and an inability to focus on higher priority tasks. This reluctance to delegate stems from a deep-seated fear of imperfection and loss of control. When forced to rely on others, individuals with OCPD may experience heightened anxiety, fearing that the outcome will not meet their standards. As a result, they might micromanage their colleagues, offering constant feedback and corrections, which can strain professional relationships and reduce team cohesion. This behavior not only affects the individual's stress levels, but also impacts team dynamics. Colleagues may feel undervalued and undermined, leading to frustration and resentment. The lack of trust can hinder effective collaboration, as team members may be less willing to contribute ideas or take initiative, knowing that their efforts will be closely scrutinized and potentially criticized. To foster a more collaborative environment, it is crucial for individuals with OCPD to work on their delegation skills. This may involve cognitive behavioral strategies to challenge their beliefs about control and perfection, as well as practical steps like setting clear expectations and gradually increasing the complexity of delegated tasks. Building trust in their colleagues' abilities is essential for reducing their own workload and creating a more harmonious and productive team atmosphere. The relentless pursuit of perfection in OCPD often leads to chronic stress and burnout. OCPD traits like control and perfectionism can create significant challenges in intimate relationships. The need for control in OCPD often lies at the heart of relationship conflicts. Rigidity in OCPD can create significant barriers to emotional intimacy and connection. Individuals with OCPD often perceive the world through a lens of rigidity, creating challenges in relationships. OCPD's strict moral code can lead to judgment and conflict in relationships. Black and white thinking in OCPD can create significant challenges in navigating differences in perspective within relationships. Acknowledging OCPD and seeking help is a testament to one's courage and commitment to a fulfilling life. Therapy, particularly CBT, is effective in helping individuals with OCPD manage their symptoms and improve their quality of life. Living with OCPD involves learning to manage its influence and embracing imperfection for a more fulfilling life.